Reasons to avoid chlamydia during pregnancy. What exactly is chlamydia? Chlamydia is a common STD, sexually transmitted disease, that can be cured easily. It is a bacterium that targets the soft, moist tissues called mucous membranes, which covers all the openings of the body. It can infect the anus, rectum, fallopian tubes, lining of the eyelid, vagina, cervix, urethra, and in rare cases the throat. Chlamydia can infect both men and women. Among all age groups, teens and young adults tend to have the highest rates of infection. You can contract chlamydia by having vaginal, anal or oral sex with someone who is infected. If chlamydia is left untreated, a mother can infect her baby with chlamydia during a vaginal childbirth. Can chlamydia affect my pregnancy? When you are pregnant, you constantly think about the health of your baby. If you have chlamydia, or you think you have chlamydia, you are probably worried about potentially infecting your baby and putting your pregnancy at risk. It is best that you know all the risks that chlamydia pose to pregnant women, and women who plan to become pregnant. The main problem caused by untreated chlamydia in women is infertility. Chlamydia usually infects a woman's cervix, but if it is left untreated it can travel to the uterus, fallopian tubes, and to the ovaries. If it travels to the fallopian tubes it can cause scarring, which can cause fertilization issues. Pregnant women infected with chlamydia who go untreated are at a higher risk for complications during their pregnancy. These complications include miscarriages, premature birth, and stillbirths. The main threat to your baby is during childbirth. Up to half of the babies who are born to mothers with untreated chlamydia will get infected during childbirth. If you get treated for chlamydia before childbirth, your baby is safe from infection. If chlamydia is passed to the baby, it might cause an eye infection or pneumonia. Between 25 to 50% of babies who are infected during childbirth will get an eye infection within a week of birth. Between 5 to 30% of newborns infected with chlamydia during childbirth will develop pneumonia a few weeks to several months after birth. These symptoms can easily be treated with oral antibiotics. What are signs and symptoms of chlamydia? Most women with chlamydia, about 75%, and about half of men with chlamydia do not experience symptoms. It is important to realize that just because you do not show symptoms does not mean you are not infected. If you get infected with chlamydia, you will most likely experience symptoms within 1 to 3 weeks after being infected. A person is considered contagious from the time they are infected until the time of treatment. Symptoms of chlamydia in women: abdominal pain, vaginal discharge, vaginal bleeding between menstrual periods, fever, a painful feeling when having sexual intercourse, pain or a burning sensation when peeing, swelling inside of the vagina, swelling around the anal area, a yellow discharge from the cervix, nausea, redness, itching, and discharge from the eye. If you see the symptoms listed below in your partner, you should advise him to get tested, especially if you are pregnant, so you will not get infected during pregnancy. Symptoms of chlamydia in men: pus, watery, or milky discharge from the penis, pain or burning feeling when peeing, pain or swelling in one or both testicles, tender testicles, swelling around the anal area, redness, itching, and discharge from the eye. Most common symptoms of chlamydia in infants: pink eye, pneumonia. How can I get tested and treated for chlamydia? It is advised that women get tested every year for chlamydia if they are 25 years or younger and sexually active. There are several types of methods for testing chlamydia testing. Your healthcare professional can give you a urine test or swab your vagina for a sample to test. Chlamydia can be treated with antibodies that are safe for pregnant women to take. Your healthcare professional can prescribe you an antibody that you can take in a single dose, or one you can take through the week. One round of treatment usually treats the infection. It is recommended that you wait until a week after you finish treatment to have sex again. It is also recommended that your partner gets tested so you do not get infected again. How do I prevent myself from a chlamydia infection? It is very important to keep you and your pregnancy safe from chlamydia. Below are a few very helpful tips that can greatly reduce your chance of getting infected. Always use condoms when having sex. There are protective barriers available for oral sex. Limit the number of sexual partners you have. It is advised that you have sex with a long-term partner who only has sex with you. Get tested for STDs every few months. Encourage your partner to get tested for STDs with you.